creases of the palm still had some germs.
Wash,
Your
wash,
fingers
and wash again.
in between fingers.
The most preventative measure to thwart the spread of COVID-19.
Palm with fingers. Then
This
you rub.
requires soap and running water, alternatively a hand sanitizer.
Usigeze thoroughly. Yabona usigeze. Gezi izandla grand, nice and clean. Zonke izinto zibamba.
Many are heeding this call.
It's obvious we have to be clean all the time. Yeah, so we have to get these precautions.
But it must take at least 20 seconds.
So 20 seconds is the minimum.
Epidemiologist Puti Sekwati displays the proper way to sanitize.
And you start by rubbing your palms against each other. And then rub the back of your hands with your fingers interlaced on both hands. And then you rub your palms against each other again, this time with fingers interlaced. And then you rub the back of your fingers with your fingers interlocked like this on both hands. And then you're gonna rotationally rub your thumbs on both hands as well. And then to clean the tips of your fingers, you're gonna rub your palms with the tips of your fingers like that on both hands. And finish off on your wrists. And then your hands are clean.
Even so, many prefer wearing a mask. That it will prevent the virus spreading is a myth.
The WHO recommends that only specific people wear masks, and these are people that are showing symptoms of cough, fever, and short breath. These ones, they should wear masks and seek medical care.
Without the symptoms, there is no need to wear a mask.
And this is because there's no evidence that shows that the mask will protect people who are not sick. And in addition, it's an unnecessary cost, it is a procurement burden, and it also gives a false sense of security, which will lead to neglecting good measures to prevent against the disease.
There are exceptions, though.
If you are a healthy individual that are looking after a person who has COVID-19, then you should wear a mask whenever you are in a room with that person.
And if that's the case, there's the proper way of wearing a mask.
So can you just then demonstrate for us how to properly wear a mask?
Okay, I'm glad you said properly, because it is important that when you decide to wear a mask, you should use it appropriately and discard it appropriately. Otherwise, it becomes a source of contamination because of the germs that it has on it. So you need to first locate the metal strip above the mask, place the metal strip on the bridge of your nose, then you secure the elastics behind your ear, and then ensure that the mask covers your nose, your mouth, and your chin. You need to avoid touching the mask during use.
Removing it after use must be done in a careful manner as well.
You need to pull the elastics from behind your ear. Avoid touching the front of your mask as it may be contaminated. Then you remove it and throw it in a closed bin.
And then, hand hygiene.
Even if you have hands that look clean, you can't see any visible dirt, there are millions of bacteria and possibly viruses on your hands at any one time. And if I touch a table and then I touch my nose or my mouth or just rub my eyes, whatever germs were on the table have transferred onto my hand, and I have now contaminated myself with those germs. So if there were germs in the environment that are potentially harmful, then I can get infected. So even when your hands look clean, they are not. And that is why it's extremely important to make sure that you wash your hands at critical times. And this includes, for example, when you get to work, before you leave work, when you get home. Whenever you've been coughing or sneezing wash your hands directly afterwards. Before you eat, wash your hands. After you've been to the toilet, wash your hands. After you've changed a child's nappy, wash your hands. And whenever you've come into contact with surfaces that are dirty or that you think may be potentially contaminated, that a lot of other people also use, then wash your hands.
They are very clean.
Makikita mo sabi, SABC News, Johannesburg.
No more germs.
Netball South Africa President Cecilia Molokwane has tested positive